How do you know you have stones? The commonest symptoms are actually pain. Sometimes they can have blood in the urine as well. The pain can be so severe that sometimes they feel like they are going to vomit, sweating. Sometimes they can present with complications from the stones like recurrent infection, or worse even if renal failure. So if you have all these symptoms, so usually the first investigation that you will do is basic investigation like ultrasound of the kidney, ultrasound of the urinary tract, which can be done easily just here bedside. Nowadays, the standard to diagnose stones is actually a CT. The CT scan is very useful because it can allow us to predict the location of the stones more accurately in relationship to the anatomy, the structures of the kidney. CT scans also can tell us the hardness of the stones, size of the stone more accurately, and also the stones burden in the urinary tract, because all these are very important in our clinical decisions and making, so that we can tailor what type of treatments is better. Okay, so apart from the imaging that I mentioned, usually we'll send your blood for analysis also to look for any evidence of infections, okay, and also simple blood test, especially to check your renal function, because stones and also leads to renal impairment. When you talk about treatment for stones, they are basically the non-invasive type and also the endourology. So non-invasive, the commonest one is the ESWL, extracorporeal shockwave, which is a type of machines that deliver acoustic shockwave through your body to disintegrate the stone. So another form of treatments of urinary tract stones is actually endourology. So endourology basically means using camera through the urinary tract system to locate the stones and disintegrate the stones. So how we disintegrate the stones, with the advancement of technology now, we have lasers that can actually vaporize the stones, and then we have also ultrasonic device that can break the stones, and also we have suctions to suck up the stones fragments. So endourologists have undergone also various modifications and miniaturizations of the technology. Nowadays the scopes are very small as an overnight procedure, so you don't need to stay long. Basically the next day you can be discharged. For bigger stones in the kidney, where the stones burden is huge, so what we normally do is we can do a procedure called PCNL, percutaneous nephrolysotomy. It is basically a technique where we make a small incisions at your back, okay, and then we use a telescope, and then through the telescope we can insert energy device like ultrasonic device to break the stones and remove the stones. Now we have mini PCNL, where the telescope are getting smaller and smaller until the size of some as big as 5 mm. So the incisions is getting smaller and smaller, very minimal blood loss, and also very short hospital stay with minimal pain. With the availability of the technology today, it allows us to treat urinary tract stones in safer conditions, more effective in terms of stone clearance rate, and also less invasive, less complications, and shorter hospital stay. And all these treatments just cause very minimal discomfort.